Evidence, Yatharth, Pramana. In the Yoga Sutra, Patanjali describes three kinds of pramana: Pratyakshanumana Agamaha Pramanani, direct perception, inference and valid testimony. इस विचार विमर्श का विषय है मानसिक स्वास्थ्य में योग के साक्ष्य आधारित अनुप्रयोग, चुनौतियाँ, संभावनाएं और यथार्थवादी प्रयोग.
It gives me great pleasure to introduce to you an Apta Purusha, Dr. Satbir Singh Khalsa ji, who is our plenary speaker for this session on the theme Evidence-Based Application of Yoga in Mental Health, Challenges, Prospects, and Realistic Roadmaps. Dr. Khalsa is the Director of Yoga Research for the Yoga Alliance and the Kundalini Research Institute, and an Assistant Professor of Medicine at Harvard Medical School. He has conducted scientific yoga research since 2001 on yoga for insomnia, stress, anxiety disorders, and workplace and school settings. He has been a practitioner and instructor of Kundalini Yoga since 1973. He coordinates the annual symposium on yoga research and is the editor-in-chief of the International Journal of Yoga Therapy, as well as the medical editor of the Harvard Report Introduction to Yoga, and the chief editor of the medical textbook, The Principles and Practice of Yoga in Healthcare. Over to you, Dr. Khalsa.
Namaste. Thank you very much for that introduction. So the title of my presentation is Evidence-Based Application of Yoga in Mental Health, Challenges, Prospects, and Realistic Roadmap. So in terms of the challenge, I think the whole idea of global mental health is very clear. It is a big burden. This is from the Mental Health Action Plan from the World Health Organization. And the challenge is that taken together, mental, neurological, and substance use disorders exact a high toll, accounting for 13% of the global burden of disease in the year 2004. Depression alone accounts for 4.3% of the global burden of disease and is among the largest single causes of disability worldwide. 11% of all years lived with disability globally, particularly for women. So these are older statistics, and of course with the pandemic, mental health has suffered even more. Now, in terms of the roadmap of how we bring yoga into society and perhaps address this mental health challenge, we currently have a large population who is practicing yoga on their own. This is being done in ashrams, yoga studios, yoga centers, gyms, and spas. In the US, we have statistics that over 15% of the population has practiced yoga. But if we want to really bring yoga into society's institutions, and we're referring to the healthcare system, the public schools, and the workplaces, this transition really requires research in order for this transition to take place. A healthcare system will not bring any kind of practice or therapy into itself unless there is evidence for research, for safety and efficacy. The same is true in public venues such as our public schools and our workplaces. These institutions will require research to demonstrate that it is safe and that it's worth putting into the curriculum of these societal institutions. Now, of course, this whole idea of the importance of research has long ago been put down by Swami Kaivalyananda himself in essentially what we can call a yoga research roadmap. And a quote from him is that persons that are equipped with an undying faith in spiritual culture and its attainment through yogic practices require no scientific interpretations of these for their progress. But those that take their stand upon reason would be satisfied with nothing short of a scientific explanation of yoga if they are to be induced to take to it. And what we're talking about here is these individuals are basically the policymakers in society, the ones that make the decisions as to what will go into healthcare or the public schools or the workplaces. Another example of where we are is put together by my colleagues at NIMHANS at the Yoga Research Center there. And this paper, authored by Dr. Varambali and Gangadhar, noted that yoga research in psychiatry is fraught with methodological and other practical challenges. Yoga as a therapeutic and evidence-based intervention in psychiatric disorders is promising and merits further attention and research. However, for it to be embraced by the medical and scientific communities, it needs to be backed by methodologically robust evidence for its efficacy and neurobiological underpinnings. So we need not just research on yoga in mental health, we need robust and rigorous research in this area. Now, turning back to this roadmap, this comprehensive mental action plan by the World Health Organization alludes to the need for research. Their action plan objective number 4 is to strengthen information systems, evidence, and research for mental health. One of their cross-cutting principles and approaches is evidence-based practice. Mental health strategies and interventions for treatment, prevention, and promotion need to be based on the scientific evidence and/or best practice, taking cultural considerations into account. And they've actually set a global target. The output of global research on mental health doubles by 2030. So there is a strong emphasis and a recognition of the importance of research to advance our treatment of this challenge to society. Now, an example of an evolution of how this research works. This is often presented as a pyramid of the strength of different types of research evidence. At the bottom, we have anecdotal evidence, and then this can turn into case reports and case series by clinicians and scientists who report evidence. So if we're talking about yoga, we can talk about anecdotal evidence of yoga experiences and then published case reports. The next level of evidence is retrospective surveys. So, for example, surveys have been done on yoga showing that many yoga practitioners report benefit of mental health. And then, of course, there are feasibility trials. These are preliminary trials. Oftentimes, these are just single group trials without a control group, just to demonstrate that that yoga is feasible for mental health and that it has some potential positive benefit. And then the bulk of research really happens at this prospective type of study, the phase 2 randomized controlled trials. This is really the bulk of research. And a lot of these trials will actually be published in journals and picked up by the media. And once the media puts this into their blogs, newspapers, and websites and newscasts, this will then reach the general public. Now, once we have a collection of phase 2 randomized controlled trials, this is then summarized by scientists in review papers and meta-analyses. And these will actually be read to some degree by clinicians themselves, the ones that are on the front lines in healthcare. And these clinicians, having acquired this information through the reviews and meta-analyses, will share this with their patient population. Ultimately, the highest level of research evidence comes through consensus statements and guidelines that are often published by teams of scientists or societies, scientific societies. And then also the publication of so-called phase 3 randomized controlled trials. These are very large randomized trials with multi-site contributions with perhaps hundreds and even thousands of participants to show the practical benefit. And it is through these consensus statements and guidelines that then the medical schools will then incorporate lectures on this topic. So, for example, we will see ultimately the teaching of yoga as a potential therapeutic modality to our medical students. And that, of course, will be future clinicians themselves. And these guidelines, of course, impact the clinicians and they also impact the media. And ultimately, that affects both the patient population and the general public. So this is how we see this sort of evolution of the different types and strengths of research contributing to the implementation of yoga into society as a whole. Now, in terms of the existing research on yoga, this is growing very rapidly. These are statistics taken from PubMed, which is the main citation source for biomedical research. And what you can see here is this is the frequency, the number of publications in every year. And these are citations which have the word meta-analysis or review and the word yoga in the title. So this is a very conservative search, and yet you can see this very dramatic increase. At the beginning of the century, there were very few reviews and meta-analyses, but now we see almost 50 published in 2020. And when we examine in some bibliometric analyses what types of conditions are being evaluated in these research studies, mental health tends to be very strong. And many of these studies are focused on the two major mental health conditions, either depression or anxiety. That's followed by two other major conditions which contribute substantially to morbidity, which is cardiovascular and respiratory conditions. Now, looking specifically at mental health conditions, this is the same analysis on PubMed citations, with the words review or meta-analysis in the title and a mental health term such as depression, anxiety, substance abuse, or stress. And again, you can see a very dramatic increase just over the past 10 years in the frequency of these publications. And so this field is growing very rapidly, which is good because this is this evolution that we're talking about that will take us to having yoga implemented in healthcare and by the general population. When we look at these statistics and break them down in terms of the actual topics, we can see that stress has a large number of publications. And again, this is the word stress in the title and the word yoga in the title. And then that's followed by the two major mental health conditions, depression and anxiety. That's followed by psychosis, particularly studies in schizophrenia, many studies on sleep and insomnia, and the growing body of research on post-traumatic stress disorder, and then finally eating disorder and addictions or substance use disorders. We've also included in our medical textbook, The Principles and Practice of Yoga in Healthcare, chapters on yoga for mental health. We have separate chapters on yoga therapy for depression, on yoga therapy for anxiety, and yoga therapy for other mental health conditions. Now, just to give you a couple of examples of the consensus statements and guidelines, this is from the UK. This is on psychosis and schizophrenia in adults, published in 2014. They noted limited evidence suggests that a yoga intervention is more effective than aerobic physical activity, improving quality of life in the short term. This is from the American Academy of Pediatrics and their guidelines and in a paper on the topic of mind-body therapies in children and youth. They indicated that yoga appears to be a promising complementary therapy for children and adolescents, especially for those with pain and emotional, mental, and behavioral conditions, with very few reported adverse effects. Yoga as a therapeutic intervention has positive effects on psychological functioning, especially in children coping with emotional, mental, and behavioral health problems. And this is a leading organization in the field of pediatrics. In the field of yoga for cancer research, this has been a very strong area of research for yoga, and so it's not surprising that we now see consensus statements and guidelines being published. This is from the American Society for Clinical Oncology in response to guidelines proposed by the Society for Integrative Oncology. And in this published paper in the Journal of Clinical Oncology, one of the leading cancer journals, they indicated that yoga is one of the modalities recommended for anxiety and stress reduction. Yoga is also recommended for depression and mood disorders. And meditation and yoga are recommended to improve quality of life in cancer patients. And another example is here in guidelines with respect to children and adolescents with eating disorders. And in this practice guideline, they indicate that yoga, in addition to standard treatments, may be a reasonable option for medically stable youth with anorexia nervosa, bulimia nervosa, and other specified feeding and eating disorders. And that is a weak recommendation based upon the level of evidence that's been published to date. And one of our speakers at the conference later today, Catherine Cook-Catone, will be addressing her research in this particular area. I want to focus my presentation today on one of the major mental health conditions, and that is anxiety. And anxiety is defined as an unpleasant feeling of worry, concern, or dread. It has physical, emotional, mental, and behavioral components to it. It's not just a thought condition. It has physical components. It can happen with or without psychological stress, and it is actually a normal reaction to a stressor. I mean, anxiety in a healthy situation inspires you and gives you the energy to deal with life challenges. And it has survival value in facilitating resolution of such challenges. However, when anxiety becomes overwhelming and starts to interfere with daily life, it may be clinically significant and be classified as an anxiety disorder. Now, there are a number of anxiety disorders, specific anxiety disorders. These include panic disorder, obsessive compulsive disorder, or OCD, social phobias, which are also classified as social anxiety disorders, specific phobias, and then the most common is generalized anxiety disorder. Now, each of these anxiety disorders has different symptoms, but all symptoms cluster around excessive irrational worry and dread. Now, referring to generalized anxiety disorder, one of the most commonly studied and important anxiety disorders, we have characteristics which really define this disorder. And this is from the DSM-5 characterization of these disorders. This is what determines whether a disorder is clinically significant. And so for generalized anxiety disorder, this means excessive anxiety and worry occurring more days than not for at least 6 months, and about a number of life events or activities. The individual must find it difficult to control the worry, and the anxiety and worry must be associated with 3 or more of the following 6 symptoms, some of them at least present for often for the past 6 months. And this includes restlessness or feeling keyed up or on edge, feeling easily fatigued, cognitive impairment, irritability, muscle tension, and sleep disturbance. The anxiety must be causing clinically significant distress or impairment in social, occupational, or other important areas of functioning. And the anxiety is not explained by another condition or drug of some kind. Now, the lifetime prevalence of GAD, generalized anxiety disorder, is 5.7%, and it's associated with high comorbidity, suffering, and burden. Many patients with generalized anxiety disorder will also experience depression and insomnia, which are very common comorbid conditions. So it is a major mental health condition that deserves our attention. So what is the rationale for yoga for anxiety? And this is a model that really sort of summarizes what we know about the basic mechanisms behind how yoga is working. So when I'm talking about yoga, I'm not just talking about the asanas. I'm also referring to the pranayama, the deep relaxation practices, and very importantly, the meditation component. Now, it's through each of these individually or together in traditional yoga that we improve physical functioning, and I'm calling this box sort of fitness, if you will. And this includes outcomes such as improvements in flexibility, strength, coordination and balance, respiratory function, which leads to an overall physical self-efficacy, which through the mind-body connection leads to a mental self-efficacy. Now, each one of these components of yoga, either alone or together in traditional yoga, improves self-regulation of internal state. And the most important self-regulatory phenomenon includes stress regulation, improving stress tolerance and resilience, and emotion regulation. And so this leads to these behavioral states of enhanced resilience and tolerance, improved equanimity in the face of the ups and downs of emotions day to day. And this leads to an overall self-efficacy of functioning mentally. Now, it's largely through the meditative component, through the focus of attention in the act of meditation, that we increase mind-body awareness, also been referred to as mindfulness. And through the engagement of the attention networks, we're improving our concentration, our cognition, and ultimately this leads to a state we refer to as metacognition, the realization that we are not our thoughts, that we have the ability to self-regulate our thought processes. And if you will, it can be considered that Patanjali's Yoga Sutras are really an essay on the topic of metacognition. Now, interestingly, metacognition is the principle that underlies the most powerful and universally used form of psychotherapy today, which is called cognitive behavioral therapy. And so yoga shares with that very powerful technique this concept of metacognition. And then finally, through the meditative component primarily, we see over the longer term typically the experience of these deep unitive states, experiences of transcendence, the flow state, which leads many people to a deep transformation and a change in life meaning and purpose. And although this takes longer and more regular practice, nevertheless, this can be very powerful for patients with anxiety type disorders. And I'm calling this box pure spirituality. Now, the one thing you can see from this model is that we're addressing the human from a wide spectrum of functions, from the gross level of connective tissue and muscle to the deepest experiences that humans can have. And as a consequence, we see changes in global human functionality, in physical and mental health and performance, stress and emotion regulation, improvements in mind-body awareness and mindfulness, and ultimately the establishment of this state of metacognition. And at a deeper level, in terms of positive psychology, we can see ultimately improvements in positive behavior, well-being, values, life purpose and meaning, and even spirituality. And from this logic model, it's very clear to see the relevance of this to something like anxiety disorders, the self-regulation of stress and emotion, and the improvements in mindfulness and metacognition are at the core of the issues that underlie anxiety disorders. And yet the physical component is also very important. And that is highlighted by the physical symptoms that are listed under generalized anxiety disorder. Patients have increased physical stress response symptoms. They have sleep disturbance and a number of physical symptoms, including fatigue, headaches, muscle tension and aches, difficulty swallowing, trembling, twitching, irritability, sweating, nausea, lightheadedness, breathlessness, and hot flashes. And different patients will experience different levels of these types of physical symptoms. And so really what we're talking about in many mental health conditions, including generalized anxiety disorder, is that these are not strictly mental or thought conditions. These are mind-body disorders. And so it makes sense to treat mind-body conditions with a mind-body intervention. And yoga is exactly such a mind-body intervention. It includes the asanas, it includes the pranayama. And these are very important components of yoga that contribute, I think, substantially to the potential benefit of yoga for mental health conditions. The same is true for other mental health conditions such as post-traumatic stress disorder and even depression.